This is Dr. Bev Knox, and you are listening to my psychology tutorials. Learn psychology while you sleep.
At some point in our lives, we all face death, certainly our own, as well as the deaths of friends, loved ones, and even strangers. Although there is nothing more inevitable in life, death remains a frightening, emotion-laden topic. Certainly, little is more stressful than the death of a loved one or the contemplation of our own imminent death. And preparing for death is one of our most crucial developmental tasks. A few generations ago, talk of death was taboo. The topic was never mentioned to dying people. That changed, however, with the pioneering work of Elizabeth Kubler-Ross in 1969, who brought the subject that those facing impending death tend to move through 5 broad stages. First, denial. In this stage, people resist the idea that they are dying. Even if told that their chances for survival are small, they refuse to admit that they are facing death. Second, anger. After moving beyond the denial stage, dying people become angry at people around them who are still in good health, angry at medical professionals for being ineffective, and angry at God. The third stage is bargaining. Anger leads to bargaining in which the dying try to think of ways to postpone death. They may decide to dedicate their lives to religion if God saves them. They may say, "If only I can live to see my second son married, I will accept death then." And the fourth stage, depression. When dying people come to feel that bargaining is no use, they move on to the next stage, depression. They realize that their lives really are coming to an end, which leads them to preparatory grief for their own deaths. And the fifth stage is acceptance. In this stage, people accept impending death. Usually they are unemotional and uncommunicative. It is as if they made peace with themselves and are expecting death with no bitterness. It is important to keep in mind that not everyone experiences each of these stages in the same way. Now let us review coping with death after a loved one have died. Bereavement is the process of recovering after the death of someone to whom we feel close to. People who were close to the dead person are known as the bereaved. Grief and mourning are 2 common emotions during bereavement. Grief is the emotional response to loss. It usually involves a variety of combination of feelings such as sadness, longing, bewilderment, anguish, self-pity, anger, guilt, and loneliness, as well as relief. The grieving process may last a few months or continue throughout one's lifetime. However long it lasts, grieving usually encompasses physical, behavioral, and emotional responses. In terms of behavior, for example, bereaved people may talk about the deceased and the circumstances of the death. Others may talk about everything but their loss because it is too painful to do so. Mourning is the customary outward expression of grief. Mourning ranges from normal grief to pathological melancholy that may lead to physical or mental illness. Whether it's the death of a child, parent, or grandparent, most people don't recover and end mourning. Instead, they adapt and change. Coping with death varies in different social and cultural groups. Now let us review the same phases of grief after a loved one have died. In the intermediate stage of grief, people often idealize loved ones who have died, and many even actively search for them. For example, a widow may see her husband's face in a crowd. When the grieving person finally accepts the loss, disorientation, anguish, and despair may follow. The survivor may feel aimless, without interest, purpose, or motivation, unable to make decisions, and lacking in self-confidence. The final stage of grief, recovery, and recognition may not occur for several years. Although many people begin to adjust after about 6 months, for the elderly, grieving is often more complex than it is for younger people. Because over a brief period, an elderly person may experience the deaths of many people who were important to him or her. Please remember, the duration and intensity of a person's grief depends on a number of factors, including the quality and loss of the relationship, the age of the deceased person, whether the death was sudden or anticipated, and the quality of care of the dying person. Also, for many grieving people, holidays are especially difficult because they are so connected to family customs and rituals. The bereaved person may dread the normal festivities because everything from cards and decorations to special meals and traditional music may remind him or her of the loved one who has died. Counselors and therapists suggest that the bereaved not force themselves to participate in special family traditions if doing so is too painful. Bereavement therapy and self-help groups offer support, but there is a similar healing power in the passing of time, the support from friends, and the act of giving support and help to others. Grieving spouses who talk often with others or receive grief counseling adjust about as well as those who grieve more privately. Facing death with dignity and openness helps people complete the life cycle with a sense of life's meaningfulness and unity. The sense that their experience has been good and that life and death are parts of an ongoing cycle. Life itself can be affirmed even at death. This is especially so for people who review their lives not with despair, but with what Erik Erikson called a sense of integrity, a feeling that one's life has been meaningful and worthwhile.